All right, let's get right into it and talk about Crohn's disease.
So, what's going on here? Essentially, the immune system mistakenly attacks the gut, causing chronic inflammation.
And that brings us to Crohn's. The key word is transmural. It means the inflammation goes through the entire bowel wall. So what causes it? Well, there's no single answer. It's a tricky mix of genes and environment.
This chart helps doctors classify the disease by its location and behavior, which is crucial for treatment.
So, what does it actually feel like to live with this? Well, the symptoms can really disrupt daily life. Most of the signs are in the gut, especially that cramping pain, often in the lower right abdomen. But here's the thing, it's not just in the gut. It can show up all over the body. Pinning down a diagnosis is tricky. It's really a process of elimination.
The whole diagnostic journey pretty much boils down to these 3 key steps.
First up, lab tests. These give doctors the first clues about any inflammation happening inside. Next, you've got advanced imaging, which gives a really detailed picture of the small intestine. And this is what doctors can actually see. An endoscopy lets them look directly and grab a tissue sample. Under a microscope, these little cell clusters, called granulomas, are a huge clue that points to Crohn's. Now, because that inflammation goes so deep, it can lead to some really serious complications. One of the big ones is a stricture. That's when scarring narrows the intestine and causes a blockage. And get this, about a quarter of patients will end up developing a stricture at some point. Then there are fistulas. These are abnormal tunnels that connect the intestine to other parts of the body. And the numbers here are pretty wild. We're talking up to 60% of patients could get one. So with all that, what's the path forward? Okay, there's no cure, but it absolutely can be managed. Management usually takes 2 main routes: medication for the inflammation and surgery for the complication. But it's important to remember surgery isn't a cure. It just handles the complication, and the disease can come back.
Which really makes you wonder, with all this new research, what's next for treating Crohn's?